Welcome to the She Found Motherhood podcast. It's Dr. Alicia here. And today our special guest is Dr. Ellen, a board certified urologist with a specialty in fertility. So today we are chatting about circumcision. So we're talking about newborn penile circumcision. Why would we do it? What are the risks? What are the benefits? How do we as parents make a decision like this for our newborn infant? And when do we need to start thinking about it? We'll get to all of that right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Well, hey there, Dr. Ellen. Thank you for joining us on the She Found Motherhood podcast. Today, we are talking about penile circumcision. So just to be abundantly clear, circumcision can be either on female or male genitalia. Today, we're focusing on penile circumcision. But before we get into that, why don't you tell us a little bit about yourself?
Thank you so much, Alicia. I'm very excited to be here. So my name is Dr. Ellen Forbes, and I'm a board certified urologist with a fellowship in male fertility and reproductive health. So that is my niche or area of expertise. I am from the East Coast. I went to Dalhousie Medical School and then moved out west for urology residency at the University of at the University of Alberta, followed by a fellowship in Toronto. And so I'm passionate about all things men's health, and urology, and circumcision certainly falls well within that domain. So I'm excited to talk more about this and give people some information to make sure that they have a fully informed decision.
Awesome. Well, thank you very much for joining us because I know certainly in the clinic, we get a lot of questions around this. And it's a decision, if you're going to do it, you got to make relatively quickly after birth. And we'll get to that later in the podcast. But why don't we start about what is penile circumcision? What are we actually talking about?
So we're talking about removal of the foreskin. So when you look at an uncircumcised penis when a baby is born or just an uncircumcised man, they have that excess skin that is basically covering the glands or the head of the penis. And that is what gets removed during a circumcision. So you're basically, if you think of it like sort of a turtleneck, then you're removing the turtleneck and turning it into a crew neck. So it's removing that portion of the skin and suturing the remainder of the penile skin together and exposing that head or glans in the penis.
Awesome. Thank you. So what are we talking about kind of numbers? Like what is the best guess for kind of how many male babies get circumcised? And how has that kind of changed over time? Because I know I've certainly seen a change in my practice. I'm just wondering kind of what that looks like historically.
Yeah, big time. So it's roughly 30% worldwide, and we have similar numbers in Canada currently. But it is highly variable from decade to decade, generation to generation, and obviously between countries and even between provinces. So there were some studies done which demonstrated back in the 70s that close to 50% of men in Canada were being circumcised as infants. Up until the 90s, that slowly declined and it settled out in the 90s around 30%. And it remains at about 30%. But between provinces, there's significant variation. So some of the territories have extremely high rates, upwards of 75% in some places, versus, Newfoundland and Labrador. At one point, it was 1% to 2%. So it's really variable. In BC, we're perfectly average at about 30%.
Awesome. Thanks. So how do patients or parents make decisions around circumcision for their little baby? How do you kind of guide them in that discussion?
Yeah, so that's a great question. It's a very personal decision, obviously, which should be made together by all parents of an infant with the interest of the infant, the best interest of the infant in mind. So when we look at studies that have examined why parents have chosen to get their infants circumcised, there was a huge study done called the Canadian Maternity Experiences Survey for thousands of women. And the main reasons that they gave, if they did go through with circumcision, were for health or hygiene. Well, that was number one, about 44%. The next most common reason was to be similar to people that they knew. So similar to the father, the siblings, or, colleagues and peers. If they felt that most of the people they knew were circumcised or the father was circumcised, then that was important to them. And then religion was also a big one. Upwards of 20% is due to religious reasons. So especially in Muslim or Jewish religions, a significant portion is circumcised because of religious beliefs.
And what do we have these societies that kind of set out guidelines. So the Canadian Pediatric Society and the American Pediatric Society, what are their positions on kind of circumcision?
Right. So these positions have been pretty stable over the past couple of decades. So in the 90s, the statements basically said that the risks and benefits are balanced. So it's an individual parent's decision, and pretty equal pros and cons. They've been updating these pretty regularly. The last reaffirmation was in 2021. And both the Canadian and the American Pediatric Societies confirm that there's really no suggestion that this is medically indicated. So they do not recommend it routinely for otherwise healthy newborns. They do recognize now that there are certain populations where if that population is at greater risk of certain infections, such as HIV or sexually transmitted infections, then the benefits may outweigh the risks in those populations. But in general, for North American population and healthy children, there's no medical indication that it should be routinely done.
Gotcha. Thank you. So why don't we segue into what are the benefits and what are the risks? So why don't we go over kind of known benefits out there of circumcision?
Yeah, that's great. So in terms of the benefits, some of the more significant benefits are a decrease in infection rates. So when we're talking about infections that circumcision can prevent, HIV is the big one. So it decreases risk by about 60%. The other STIs that are significantly decreased include HSV, which is a herpes simplex virus, and HPV, which is human papillomavirus and is also responsible for causing penile cancer and things like cervical cancer. It's about 30% effective at decreasing risk of HSV and HPV. In terms of the HIV risk, it's such a low prevalence within North America that it doesn't necessarily factor into most people's decision making, I don't believe, because it's just so rare. It's sort of like, there's lots of malaria in Africa, and so people use mosquito nets. Well, we have mosquitoes here. Why aren't we using mosquito nets? Well, we just don't have that same prevalence of disease, so it just doesn't make sense to routinely do that.
Yeah, and when you're looking at these numbers, so you said it's a 60% decrease in risk of getting HIV or transmitting HIV too, presumably. So like if our prevalence rate is 1 in 1,000, brings the number down to 0.4 in 1,000 versus if your prevalence rate is 100 in 1,000, then decreasing it by 60% brings it down to 40 in 1,000. That's a pretty big change. So that's the thing you have to look about with a lot of these studies and that percentage decrease is you actually have to look at the broader picture of what your community is. And so like you said, in Canada, the HIV rate is extremely low. So decreasing it by 60% is going to keep it extremely low. But if you have a really high prevalence, that's going to make a big impact decreasing it by 60%. And so that's where those kind of guidelines can really change from one population to another population.
Exactly. Yeah. Some of the other benefits. So it also does decrease the risk of urinary tract infection within the first year of life for boys. But again, urinary tract infection in infant boys is relatively rare. So again, it's not routinely recommended to prevent UTIs because it is still pretty uncommon. But if you have a baby who's having recurrent urinary tract infections, your physician may suggest that you consider circumcision. But obviously, you wouldn't know that at the time of birth when you're trying to make this decision. The other things that it can help prevent would be penile cancer. Again, this is very rare, and prevention of foreskin issues. So this is a bit more common and something that may factor into people's decision making. So you can have foreskin issues later in life if you're uncircumcised. So that includes things such as phimosis, which is basically a really tight foreskin that's not able to be retracted. And that can cause difficulties with urination. It can cause inflammation or discomfort. It can contribute to urinary tract infections. And so most men, by the time they're teenagers, are able to fully retract the foreskin, but in some cases, they can't. And they may have to have a circumcision at that point, which is a little bit more, potentially traumatic. So those foreskin issues and inflammation of the foreskin is another big one. So that's a balinal posteitis. So you may have seen this if you've had little boys come into clinic and their foreskin is sort of red and swollen and inflamed, and they need treatment for that because it may be infected. That's something that is prevented with circumcision. It's not very common, but it certainly does happen. We do see it. So that's something that would be prevented. And then, of course, there's sort of personal preference. So either because of religious reasons, family beliefs, if cosmonesis, hygiene beliefs, all that plays into the decision making in terms of benefits.
Yeah, for sure. And you can have good foreskin care, though. So
Yes.
just because your baby or your young child who has a
Mhm.
penis is has an episode of irritation of their foreskin does not mean you should get a circumcision for that one episode. We're talking kind of recurrent issues that are ongoing despite good hygiene and despite kind of like ongoing proper care of the foreskin, right? So
Exactly.
those would be the reasons that the recommendation would be made for a surgery, right? All right. So, Dr. Ellen, we chatted a little bit about the benefits of circumcision. Why don't we chat a little bit about the risks of circumcision?
Yes, that's a great thing that we definitely need to cover. So, anytime that you're having any procedure or surgery done, there are always risks. And so, even in the hands of an experienced provider who's using sterile equipment and the proper techniques and everything, there are still some risks that can occur. So, the most common ones with circumcision include bleeding and infection. The bleeding risk, so it's about 1 to 3% in terms of percentile for things like extra bleeding and infection. The bleeding typically does resolve with applied pressure. So if parents have their baby circumcised, they can expect some blood in the diaper, typically smaller than a toonie sized afterwards. But it seems to be actively bleeding a little bit more than that. The first step is to apply pressure to see if you can get it to stop on its own. Bleeding will often stop on its own simply with pressure. So at first you apply pressure for a couple of minutes. If that doesn't work, then apply pressure for 10 or 15 minutes. And then if it still seems to be oozing, that's when you call your physician. Infection risk, again, are about 1 to 3%. And that is when it starts to appear a little bit yellowish greenish. Maybe there's some pus there or a little bit of redness around. And that is usually treated with antibiotics and it clears up quite quickly. Other risks include core cosmesis. So it doesn't look as good as you had hoped. So when the skin is healing, sometimes attachments form where they shouldn't. So that can be between the remaining skin on the shaft of the penis and the glands. That's called a skin bridge. And when that's really adherent, sometimes it will stay that way. And when they're a bit older, they may be a little bit self-conscious about that attachment. It is something that can be treated or fixed, but typically that requires another procedure when they're older. Some other risks include something called meatal stenosis. So when that skin at the end of the penis is removed and it's no longer there to sort of protect the head or glands of the penis, it rubs against the diaper. And sometimes that causes irritation or inflammation that creates scar tissue, and that narrows down the opening that they pee through. And that's called meatal stenosis. So signs of that would be when they pee, it sort of sprays in all directions. They may have a double stream, so it might split into two. They may complain that it's painful or difficult to urinate, or they may be having urinary tract infections. And that, again, can be fixed, but that requires another procedure. So that's not something that you want to deal with if you can avoid it. There are some more serious complications, which are more rare, or which would include removal of too much skin, and then the penis is sort of a bit hidden. And again, that can be corrected with reconstructive surgery or damage to the penis. So that's a really unfortunate complication because most ways of doing it these days and devices that are used protect the head or glands of the penis, but there have been cases of amputation or, cutting off part of the end of the penis. So that would be the most serious thing. And also persistent bleeding, especially in patients who have hemophilia, for example, that are undiagnosed, which can rarely lead to death, of course. That's very serious, but that's extremely rare. So The most common things are a bit of persistent bleeding that may require attention or infection that may require antibiotics. And then the more serious complications are thankfully quite rare.
And then in terms of pain management during this, because I would imagine that that is an issue, how do, and maybe we'll talk about this a bit later, but what do you do for pain management? Because newborns do feel pain, right? And so we need to take that into consideration. What does that look like?
Yeah, that's a great point. So the pain management at the time of the procedure is done through anesthetic. So there's a couple of different ways of giving anesthetic, and we're not talking about general anesthetic where the baby is put to sleep at all. They're not given anything that makes them sleepy or drowsy. But we're talking about local anesthetic. So there are creams or gels that can be applied to the area which numb the skin, and there are also local anesthetics that can be injected into the area with a tiny needle. So they may feel just a little pinch as the needle goes in, but it's quite quick, and then the anesthetic takes effect right away, and they no longer feel that discomfort. And if you're doing the injected anesthetic, it typically lasts a few hours. And then also comfort from the parents can be very helpful. So nursing right afterwards, or feeding the baby and cuddling, and some sugar as well, sugar water on the soother, if they're using soothers, things like that, can be helpful. And that has been shown to be important in terms of infant pain management.
Awesome. So as a urologist, when you kind of chatted a little bit about reasons that you would recommend it. So we kind of talked about, a child with recurrent phimosis or balanitis or a recurrent urinary tract infections. That might be a reason to, say, this might be a good idea. This is maybe something that you should consider in your child with a penis. When would you not recommend getting a circumcision?
Yeah. So it's important to not recommend circumcision, at least not before consulting with a urologist in babies who have a condition called hypospadia. So if you notice, and you may be the first one to notice this, the parents might be the first one. So, because sometimes it's a pretty quick overview of the physical examination when you're in hospital, kind of checking that everything's from the right place. And so it may be overlooked, but they may have something called hypospadias, where basically the penis doesn't form 100% completely. So as the penis is forming in the fetus, it's basically zippered closed on the underside. So the penis comes together, and then the foreskin is the last thing to come together around the penis. So if you notice that the foreskin in your baby isn't all the way around in a complete circle, or if the opening of the tip of the penis, so where they pee out of, the urethra meatus, if it isn't right at the tip, but it's actually a little bit underneath on the lower part of the glands, or even further underneath down on the shaft, those are all aspects of hypospadia. So it can be various degrees. It can be mild or severe. But the important thing with hypospadias is that it's typically treated by a pediatric urologist or a urologist. And we use that foreskin to reconstruct the penis to give it a more normal appearance, and to try to get the opening that they pee through and that eventually they will ejaculate through, for fertility down the road. We're trying to get that in the right position towards the end of the penis. And so we actually like to have that skin to use in the reconstruction. And so that's why if there's any degree of hypospadias, you don't want to send that baby to be circumcised. The other common issues are if there's any family history of bleeding disorders. So we really don't want to circumcise patients who are hemophiliac, especially in infancy. Sometimes that's not something that we know, but, people may not realize that there's a family history of that. So that's one of the reasons why, if there is bleeding afterwards, if it's a small amount and it stops with pressure, that's normal. But if there's really persistent bleeding or a consistent flow of blood that can't be stopped, then that's a concern, and you should get that checked out. And then the other issue is if your baby's born prematurely. So in small babies, we don't want to put them through procedures until they've matured to, full size, typically of a healthy newborn, so that they can have the best outcomes.
Awesome.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as you move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
You kind of touched on it a little bit, but when is the optimal time for circumcision if you're doing it not for a medical reason? So a typical kind of newborn circumcision is done for personal choice, not for medical reason. So when would you advise parents kind of try to aim for that procedure to be done if they choose to circumcise
Yeah,
their baby's penis?
good question. And this is part of the reason why it's important to have this discussion early. As you are well aware, you can't always predict when you're going to have your baby. Sometimes they come a lot sooner, and it's something that we aim to perform within the first week of life. And so if you haven't had that discussion and you're trying to figure that out when you've got a crying baby and you're immediately postpartum, and if they're premature, there's additional stress. So this is something that you should really be discussing within the first couple of trimesters with your partner, if you have a partner, because we're really aiming to get it done within the first, 7 or 8 days of life. So there's been a couple of studies done. There's something called the neonatal infant pain scale, which uses various factors that we know are indicative of pain in babies. So breathing patterns, movements, cry, things like that. It takes into account all of these things to give a value on how much pain that infant seems to be in. And using the scale, we can see that babies that are within the first week or so of life have quite a low infant pain scale score. So very little indication that they're experiencing any pain. So, about 6.5%. 6% of babies under a week of age have moderate pain with the circumcision. But when you wait, even just up to 4 weeks of life, that goes up significantly. So by 4 weeks of life, almost all babies will be showing some signs of discomfort using the pain scale. So we really try and get it within the first week of life. If it's week 2 or week 3, that's still better than waiting until they're, a month or 2 months. And you may actually have more difficulty finding someone to do it if you wait as well, because a lot of physicians who do neonatal circumcisions will only really perform it within the first month or so. And then beyond that, they may say, no, you have to go see, a pediatric urologist, and you'd likely have to wait a while to see them. And, if we're seeing babies and we're going to do a pediatric circumcision for something like recurrent UTIs or something like that, then we wait until they're at least 6 months and do it typically under anesthesia, general anesthesia. So it's a bit of a bigger production. So we're really hoping to get that done as soon as we can within the first couple of weeks of life. And so that's why it's important to have the decision made well ahead of time.
And something that I just kind of came to my mind is a lot of our followers, a lot of people who listen to our podcast and follow us on our Instagram, talk about not seeing their care provider until 6 weeks postpartum, which is kind of, you've now missed the boat on that. In our practice, we see people at 1 week, 2 weeks, 4 weeks. So we'll often kind of have those discussions in the third trimester. The parents will make a decision, and then at their first week postpartum, we'll do an exam on baby and give them the name of providers who will happily do the circumcision for them. And they're very good at getting the babies in very quickly because they recognize the time crunch. But in a lot of communities, people aren't seeing their providers until 6 weeks postpartum. And so kind of having those conversations earlier, getting that information is really important, especially in those communities.
Mm-hmm.
Yeah. So we've kind of talked about what circumcision is. We've talked about, the risks and benefits, things that you would think of as a parent to kind of make that decision. Why don't we actually talk about what does that procedure look like? Now, you don't need to go into great detail, but just to give if people decide that they are going to do a circumcision, what would they expect during that visit? What does that look like?
So it depends on your provider. So as urologists, we commonly perform circumcisions, pediatric circumcisions, quite similar to how we would perform an adult circumcision. So that's basically taking what's sort of called a freehand approach, or, using a scalpel. We often use a marking pen to kind of delineate exactly where we want the skin to line up. And then we use a scalpel and remove the skin that way, and suture everything back together, sort of with a very intentional approach to make it look kind of exactly like we would like it to look. But in babies, it can often be done sort of in quicker, a little bit easier ways because of some devices that have been invented. So these are basically clamps. There's a couple of different clamps. One is called the Gomco clamp, which is basically a metal device where there's a little bell-shaped portion that protects the head of the penis. So the foreskin often needs to be stretched a little bit, or perhaps incised a little bit to get the device in, but then it protects the head of the penis. The loose foreskin is pulled back up over the metal device, and then that excess skin on the outside is removed, is basically cut off. A similar device to that is something called the Plastibell device, which is plastic instead of metal. Something that's a bit different about the Plastibell is that it's a suture is used to basically tie, instead of using a scalpel to cut the foreskin and to let it heal by secondary intention starting right away. The scalpel is used to remove the excess foreskin, but then a suture is also removed, a suture is also used, and that ties the foreskin against a little plastic ring, which will eventually fall off typically after a week or so. So that one's a little bit different because you're going home with, it's basically a foreign body attached to the infant's penis. So you do have to be a bit more aware of what's going on down there, because it can shift in location, or, if it stays on and it doesn't fall off when it's supposed to, or something like that, you need to follow up with your provider. So that's a little bit different. And then the other one is something called the molding clamp. And that's sort of like, those paper cutters that you see at Staples, for where you it's kind of like that, where the excess foreskin is separated from the glands and then pulled ahead of the glands, and then basically cut off just beyond the tip of the head of the penis. And then again, it heals by secondary intention, meaning that those cut edges of the skin heal back together and seal off. So there's a few different devices, and it really depends on who you're going to see, which way they prefer to do it. But the results are pretty similar. So whatever they are most experienced with and comfortable with is typically what you will be offered.
So when you're looking for a technique, is your advice, Dr. Ellen, would you say more to look at the provider?
Yes, exactly. Definitely choose based on the provider, based on their experience and your comfort level with them and the rapport that you establish with them. Make sure that you're comfortable with them answering your questions and being available for follow-up, because all of the techniques have quite good results overall.
Yeah. And just so I do maternity care, so I see a lot of circumcisions a few days after they're done. And to be totally honest,
They always look awful.
they look off. They look off. I
Yeah,
really dislike seeing
I know.
babies. Like, I try to see them right before they're circumcised, and then like a week later, and I don't know what to expect, right?
Yeah.
So I think that follow-up piece is very key. You need to have a provider that is going to have good follow-up that you can link with. So if you are having unexpected bleeding, if you are worried about this plastic ring not falling off, if you're worried your baby has a bit of an infection, you can get a hold of them, because most of us, and I see tons of babies, I don't even know what to expect post-circumcision. So making sure that I think that's a really important comment that you made, that you need to choose the provider, not necessarily the method. So they need to have, good, not reviews, but good outcomes. They need
Good reputation. Yeah.
a good reputation. And the other thing that is going to come in a lot of places to factor is cost, because this isn't covered in many places. That's right. This is not a fee for service. This is a out of pocket cost. And I know in our community that the costs are kind of range from $250 to $500 for the procedure. And so that's another factor that's going to come in. But cheaper does not always mean better, but more expensive does not always mean better either. That didn't make sense, but you know what I mean. So
Yeah. And the other thing to remember in terms of cost is, so in that infant period, it is typically in the range of, a few $100s up to $500. If you end up waiting and deciding that you want them circumcised later, if it's for medically indicated reasons, so if they have recurrent UTIs, they keep getting infections of the foreskin, something like that, then it is covered. If they're not having any of those issues and you just sort of wish you had had it done, and you're looking to get them circumcised at, say, 6 months or 12 months, or even as an adult, and there's no medical reason to have to do that, then you're going to be paying more than if you paid as an infant, because typically it's done with more anesthetic, with general anesthetic. And so you're looking at covering, OR fees, anesthetic fees, and surgeon fees. So you're looking in the range of, probably $1,000 or $2,000 as opposed to a few $100s.
And this is where in BC and
In
Canada.
BC and Canada, yeah.
Keep that in mind, everybody in the States.
Yep, exactly. I think everywhere in Canada, it's if it's elective, meaning it's not medically necessary, then you're going to be paying for it out of pocket.
Yeah, I agree. So after the procedure is done, what we kind of talked about how gross it can look a couple days after, but what should parents expect over the next kind of week or two in terms of healing?
Yep. So things that are normal but may be intimidating or a little bit concerning when parents look would be a little bit of blood in the diaper. Again, if it's not flowing and it's a small amount, and if it stops with pressure, that's okay. The penis always looks kind of terrible for the first few days because of swelling mostly and the healing that's going on. So when skin is healing together by secondary intention, so just sort of naturally on its own, not with sutures, it's normal for it to have what's called granulation tissue. So it can have sort of a bit of a yellowish or pinkish appearance while it's healing, and it may appear a little bit mucky, and you may think maybe this is an infection, but most of the time when we look, it's not actually infected, it's just healing. But if you are concerned, then, you can always take a picture and send it to your physician or bring them in. Other things to expect would be a bit of fussiness of the infant. So if they're a little bit out of sorts for a couple of days, that's to be expected. You can use Tylenol if it seems like they're in a bit of discomfort. Things that you want to watch out for, which would not be normal, would be continuous or significant bleeding that you can't stop. If it's red and swollen and it seems to be worsening, so if you have redness that starts out, let's say, just around the incision, about a half centimeter, and then all of a sudden it's 1 centimeter and then 2 centimeters, and it seems to be covering more area, that's a sign of infection. If the infant has a fever, or if they haven't peed, so if they haven't had wet diapers in 12 hours, for example, after the procedure, then that's a concern as well. So any of those things you definitely want to get checked out. But if it's just sort of that it doesn't look like you expect a circumcised penis to look, that's a pretty normal comment, and it's probably fine. But if you're concerned at all, then you should check with your physician.
Awesome. Thank you. Well, that was a whole lot of information. What did we cover? We talked about what circumcision is. We talked about kind of how many babies get circumcised in our country anyway, so in Canada. We talked a little bit about how to make decisions around circumcision and talking with your partner. It's interesting, in the middle of the podcast, Ellen's partner, husband, came on and talked about he used to be in the military. And so there's always lots of shower room banter around wishing that they'd be involved in the decision to get circumcised or not get circumcised. So I think it's really important to recognize that a lot of men or adults with penises kind of maybe want to actually have been involved in that discussion. And so maybe thinking about that piece at the same time, which I thought was an interesting perspective. We had benefits and risks. Yeah. And we talked about how to choose a provider and what the different techniques that they might look at, and then how to care for the circumcised penis afterwards if you do choose to do it.
Can I add one thing?
Yes.
Lots of Vaseline. So one of the important things is that we don't want the healing penis to become stuck against the diaper. And we also don't want the skin from the shaft of the penis to become attached to the head of the penis, get that skin bridge or adhesion. So the ways that we prevent that and keep the baby comfortable is by using tons of Vaseline for those, especially for those first few days after the circumcision.
Perfect. Ending it on with a final pro tip. So Dr. Ellen, if people want to find you, how can they find you? Where are you on social media?
Yeah, so I'm Ellen Forbes, MD. on Instagram and Facebook. And I've got some exciting things coming up, launching a website and a podcast of my own. So stay tuned for that. Just follow my social media feeds for more information.
Awesome. So thank you so much for coming on. This was a great discussion around kind of a bit of a controversial or a topic that people don't always know how to make decisions around. So I think that hopefully this is helpful to people in terms of deciding on what they're going to do with their newborn penis babies.
Definitely. Thanks for having me.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.
Let's talk a little bit about the risks. Pearl, trying to podcast your
Hello.
It's all working.
Yeah, she's recording it right now. We're discussing risks.
You're on our podcast now.
Oh, I'm on the podcast. What can I contribute? What do you need? A male's
We were
perspective
talking about
on
circumcision, so I don't know if you want to contribute.
Arlo's
Sure, I'd love to contribute. I wish I had a decision. I wish I was involved in that decision-making process before it happened when I was a young child.
There you go. See? Brenda,
Sure, why not? Yeah.
what'd you guys do with Arlo?
We left him as is.
Yeah.
You know, this is really funny, and I wish I had more time to contribute because as a military guy, we're in these situations where we're in open showers.
Yeah, you probably have.
There's lots of conversations about how guys either wish they got snipped or they wish they didn't get snipped, and so it's, this is a great conversation.
Okay, well, you're going to come on a podcast with us sometime.
Sounds good. Okay, I'll pass it back to Alice.
Nice to see you, Carl. Interesting. Well, maybe we'll splice that in somewhere.
That can be like at the bloopers at the end or something.
Yeah.